It's time for another warm-up review. Let's get going. Damage to which artery would produce each of the following presentations? So first we have bilateral loss of lateral visual fields. So this is the anterior communicating artery aneurysm compressing on the optic chiasm. Broca or Wernicke aphasia. So that's going to be the middle cerebral artery stroke. Next we have unilateral lower extremity sensory and/or motor loss. This is going to be the anterior cerebral artery stroke. Unilateral facial and arm sensory and/or motor loss. This is going to be the middle cerebral artery stroke again. Next, which diuretic is used in the treatment of idiopathic intracranial hypertension? Acetazolamide. So we don't actually use this much for diuresis, but we use it for pseudotumor cerebri and glaucoma and altitude sickness. Next, when does implantation of the blastocyst take place? So that's going to be 6 days after fertilization. All right, that's it for the warm-up. Let's get to that video.
In this video, we're talking about receptors, especially the cholinergic and adrenergic receptors, and how these receptors make things happen inside cells on a molecular level. And we often talk about the effects of norepinephrine or acetylcholine or dopamine or BNP, but it really depends on what the receptor the chemical interacts with. The receptor is what determines the downstream effects. Now, the main types of receptor we're going to focus on in this video are called G-protein linked receptors. And we're focusing on them because G-protein receptors are about a 4-star topic for step 1. So as we dive into this crazy detail, keep in mind this is something you're likely to be tested on. Now, when you stimulate a receptor on the surface of a cell, there are several different mechanisms that translate that signal into some kind of signal inside the cell to make things happen. For example, back in Foundations, we talked about tyrosine kinase receptors on the plasma membrane. Well, G-protein receptors are another type of receptor on the plasma membrane. This G-protein receptor has a protein that passes through the plasma membrane 7 times. It's usually depicted like a big bundle of sticks, but sometimes it's referred to as a 7-pass transmembrane receptor. It's also known as a G-protein linked receptor because it's associated with this G-protein, which we've depicted in blue, and it activates the G-protein to do something. So let's review some different classes of receptors and what downstream effects they have, starting with cholinergic receptors. Remember, there are 2 flavors of cholinergic receptors, nicotinic receptors and muscarinic receptors. Now, nicotinic receptors are ligand-gated ion channels. Acetylcholine binds to the receptor and the ion channel opens up and it lets cations like sodium and potassium enter the cell. So, nicotinic receptors don't use G-proteins. But the muscarinic acetylcholine receptors are G-protein linked receptors. So let's talk about muscarinic receptors for just a minute. There are several subtypes of muscarinic receptors, which are M1, M2, and M3. And actually there's also M4 and M5, but we're just going to focus on M1, M2, and M3. The M1 muscarinic receptors are found in the enteric nervous system, where they help the gut rest and digest. M2 receptors are going to decrease cardiac contractility and decrease the heart rate at the SA node. And then the M3 receptors are going to increase bladder contraction and increase gut peristalsis to start making things leaky, right? M3 receptors in the tear glands cause lacrimation or tearing. They also cause meiosis, and they cause some bronchoconstriction. Now, you've seen all those parasympathetic effects before. You just need to recognize that there are different classes of muscarinic receptors in different target tissues. Then for the adrenergic receptors, you're already familiar with the subtypes of adrenergic receptors like alpha-1, alpha-2, beta-1, and beta-2. So let's start with the alpha receptors. Stimulation of alpha-1 receptors causes vascular smooth muscle contraction. So alpha-1 receptors cause vasoconstriction. That's why epinephrine and norepinephrine will raise the blood pressure because they're stimulating those alpha-1 adrenergic receptors. Now alpha-2 receptors are the presynaptic autoreceptors. They inhibit further norepinephrine release. So alpha-2 stimulation inhibits sympathetic outflow, and it's going to inhibit some of that alpha-1 mediated vasoconstriction. That's the main action. Just to confuse things a little bit, alpha-2 receptors are also found on certain blood vessels, where they do cause a little bit of vasoconstriction. Now beta-1 receptors increase heart rate, and they increase myocardial contractility. That's why adrenaline makes your heart pound in your chest. Beta-2 receptors cause vasodilation and also some bronchodilation. So for beta-1, I want you to think about increased heart rate and contractility. For beta-2, I want you to think about vasodilation and bronchodilation. So muscarinic receptors and adrenergic receptors are all G-protein receptors. They're all 7-pass transmembrane receptors that activate G proteins to do something. But G proteins are also found associated with other types of receptors outside the autonomic nervous system. So there are dopamine receptors. Dopamine is another catecholamine, but it's not part of the autonomic nervous system. Dopamine is mainly a neurotransmitter in the brain. So D1 dopamine receptors will relax renal vascular smooth muscles, and then D2 dopamine receptors are mainly located in the brain. Histamine receptors also use G proteins. H1 histamine receptors are responsible for allergy symptoms like nasal secretions and bronchial mucus production. They're going to cause pruritus or itching and also some bronchoconstriction. So that's why if a patient's having an allergic reaction, we can give an antihistamine to help relieve some of those allergic symptoms, to block those H1 receptors. Then H2 histamine receptors increase gastric acid secretion. So if you want to inhibit allergy symptoms, you're going to give an antihistamine to inhibit H1 receptors. If you want to inhibit gastric acid production, such as in a patient with a peptic ulcer, you might give an H2 blocker like cimetidine or ranitidine. Then one more group of receptors that are linked to G proteins are the vasopressin receptors. Now there are two different subtypes of vasopressin receptors. V1 vasopressin receptors cause vascular smooth muscle contraction. So sometimes vasopressin is given during codes to cause some vasoconstriction. And then the V2 vasopressin receptors are going to increase reabsorption in the collecting tubules of the kidney. So remember, another name for vasopressin is antidiuretic hormone, or ADH. And ADH leads to an antidiuresis, or a reduction in urine volume. And it does that by stimulating these V2 receptors in the kidneys, which again increases resorption of fluid in the collecting tubules of the kidneys. So I count 13 different receptor classes that you need to know as being linked to G proteins. So these are G protein linked receptors. M1, M2, and M3 muscarinic receptors, and again those respond to acetylcholine. Alpha 1, alpha 2, beta 1, and beta 2 adrenergic receptors, which respond to epinephrine and norepinephrine. You have the D1 and D2 dopamine receptors, the H1 and H2 histamine receptors, and the V1 and V2 vasopressin receptors. Now let's look at how these G protein receptors work in some detail. And again, this does get tested pretty regularly. Each of these neurotransmitters and signaling chemicals activates a specific type of receptor, and each receptor is in turn utilizing a specific type of G protein. And the G proteins come in three distinct flavors: GQ, GI, and GS. So, what does a GQ protein do? A GQ protein, once it's activated by its specific neurotransmitter, is going to activate an enzyme called phospholipase C. So, take norepinephrine as an example. Norepinephrine activates an alpha-1 receptor, and that alpha-1 GQ protein is going to then activate phospholipase C. Phospholipase C is going to act on a chemical called phosphatidylinositol bisphosphate. And that's a mouthful, so we abbreviate it PIP2, phosphatidylinositol bisphosphate. So phospholipase C cleaves PIP2 into two chemicals, IP3 and DAG, and both of these have downstream effects. IP3 is inositol triphosphate, and inositol triphosphate increases intracellular calcium. Again, calcium is very important. That increase in intracellular calcium can then mediate any number of different effects. And then the other chemical here, when PIP2 is cleaved, it also produces DAG, which is diacylglycerol. And that diacylglycerol has the downstream effect of activating an enzyme called protein kinase C. So the downstream effect of activating phospholipase C is the activation of protein kinase C. So that's pretty easy to remember. Associate those C's together. And then also C for calcium. So I want you to remember that GQ activates C, Q and C. And there's a great mnemonic. Cute C's have one M&M. Cutesies is like a cute little kid, a cutesy, but it's also Q and C. So cutesies have one M&M. And the have one M&M tells you which receptors utilize this GQ protein. So there's H1, alpha 1, and V1. The histamine 1 receptor, the alpha 1 receptor, and the vasopressin 1 receptor. That's the have one part of the mnemonic. And then the M&M is for M1 and M3. So remember, cutesies have one M&M, and remember all the C's in that GQ pathway: phospholipase C, protein kinase C, and calcium. And you've got it. Now, it's almost totally clinically irrelevant, but you will be tested on it, so you need to know it. So GQ is the first type of G protein. Then the second type of G protein is GS, and the S is for stimulates. So what's it stimulating? Well, it's stimulating adenylyl cyclase. And adenylyl cyclase, what does it do? Well, it converts ATP to cyclic AMP. And then cyclic AMP is a modulator that has a downstream effect of activating protein kinase A. So GS stimulates adenylyl cyclase to convert ATP to cyclic AMP, which activates protein kinase A. And then GI is the third type of G protein, and I is for inhibit. So GI inhibits adenylyl cyclase. So you have less production of cyclic AMP and less activation of protein kinase A. So of all those receptors, D1 and D2 and beta 1 and alpha 2, out of all of those, which ones use GS and which ones use GI? Well, the mnemonic for the GI-linked receptors is the MAD2s. I think of inhibit and MAD as being negative words, so they kind of go together. So GI is the MAD2s. M in MAD is for M2, A is for alpha 2, and D is for the dopamine D2 receptors. So the MAD2s. So if you can remember those two mnemonics, cutesies have one M&M for GQ, and then the MAD2s for GI, then you can just know that the GS protein is the default, and all the other G protein receptors we listed are going to use the GS mechanism. So that includes beta 1, beta 2, D1, H2, and V2. Now let's take a look in your study guide at the chart titled Signal Transmission Pathways. At the top, there's a complex pathway that summarizes G proteins a little bit differently. And then underneath that, we've replaced the steps with numbers so you can quiz yourself. Now, I'm not going to go through all of this again, but let's hit some of the high points. Over here on the left, the hormone or transmitter binds to that 7-pass transmembrane receptor, which is linked to a G protein. And then following it down, you have activation of the alpha subunit of the G protein, which then activates adenylyl cyclase, cyclic AMP, and protein kinase A. So, which G protein does that? That's GS, S for stimulate, right? And then down in the middle, this would be a different receptor because it's a different second messenger pathway. Here, the activation of the G protein activates phospholipase C and IP3 and increased calcium, and then DAG and activation of protein kinase C. So which G protein would do that? That would be GQ. Now the other way to get to this phospholipase C pathway is with a tyrosine kinase receptor. You start with a growth factor binding to a tyrosine kinase receptor. So what kind of transmitter uses a tyrosine kinase receptor? Well, none of the things we've been talking about. Dopamine and acetylcholine and all these other transmitters use G protein linked receptors. For tyrosine kinase receptors, we're mostly talking about things like insulin and prolactin, and also several growth factors like insulin-like growth factor, fibroblast growth factor, platelet-derived growth factor, growth hormone. So all of those use a tyrosine kinase receptors. And there are two different pathways that a tyrosine kinase receptor can use. One pathway is similar to the GQ pathway in that it activates phospholipase C. But the other pathway, the more well-known tyrosine kinase pathway, is the RAS activating pathway. You have an adapter protein that activates the RAS activating system, and then that activates protein kinase 1, 2, and 3. And then that has a downstream effect. So these pathways are important to understand. Again, it's about a 4-star topic. So make sure you know the difference between GQ, GS, and GI. Make sure you know what each of those different G protein receptors does. Make sure you know what these pathways look like and be able to draw out these pathways in your mind. All right, before the end of session quiz, let's do another whiteboard review. In this whiteboard review, we're going to match the 3 different classes of G proteins to their actions. So we have GI, GQ, and GS. So let's start out with GI. Remember we said GI, the I stands for inhibit. So GI starts out by inhibiting adenylyl cyclase, and that leads to decreased cyclic AMP, and that leads to less activation of protein kinase A. Then for GQ, GQ is the Hansen protein. You can remember Q and C. So we start out GQ activates phospholipase C, and that phospholipase C is going to cleave PIP2 to IP3 and DAG. So here we have 2 actions. The IP3 is going to increase calcium. We'll draw a little arrow there. And then the DAG is going to activate protein kinase C. And then for GS, remember GS, S is for stimulate, so GS stimulates adenylyl cyclase, and that's going to increase cyclic AMP, and that will activate protein kinase A. Now let's also practice listing the transmitters that go with each of these. So GI, remember the mnemonic is the MAD2s. So for GI we have M2, alpha 2, and D2. Then for GQ, That's cutesies have one M and M. So that's H1, alpha 1, V1, and then M1 and M3. And why is it M3? Well, you know it's M3 and not M2 because M2 goes with the MAD2s. And then GS is all the leftover receptors. So you really need both of these mnemonics. So for GS you have beta 1, beta 2, H2, V2, and D1. All right, good job on this one. So for that you get 10 gold stars. So now it's time for the end of session quiz. So go ahead and work through the quiz and then we'll go over the answers together. All right, this is a short quiz, but again, it's very, very high yield. First question, what G protein class does each of the following receptors stimulate? So alpha 1 is GQ, alpha 2 is GI, beta 1 is GS, and beta 2 is also GS. M1 is GQ, M2 is GI, M3 is GQ, and then D2 is GI. And the last question, outline the pathway by which stimulation of a GS receptor activates protein kinase A. So the GS receptor activates adenylyl cyclase, and then adenylyl cyclase turns ATP into cyclic AMP, and then cyclic AMP activates protein kinase A. That's it for now, but we're going to keep quizzing you on these G protein pathways throughout the course in the warm-up quizzes because you really do need to know them. So I'll see you next time.